I see a lot of patients with interstitial cystitis, also called painful bladder syndrome. I like to refer to it as inflammation in the bladder. Here's what I know about it. First of all, I often identify this condition in patients who come to the office convinced they have a urinary tract infection. We check their urine and there's no bacteria. This may be this condition, interstitial cystitis. Symptoms include bloating, pressure, feeling like you have to pee all the time, urgency, frequency. Some women say that it even hurts to touch their bladder. They often need to unbutton their pants. And then pain or burning in the urethra as well. And there's some other symptoms, but those are the most common. What causes this? Honestly, we don't really know, but people tend to have flares of symptoms around their menstrual cycle, around times of stress, or specifically when they overdo bladder irritants. More on that. Things that irritate your bladder, just like certain people can't eat certain foods because it irritates their esophagus, they get GERD, they get indigestion. People respond in the bladder the same way. Caffeine, alcohol, spicy food, anything acidic, lemons, limes, oranges, tomatoes, vinegars, carbonated beverages, those can all irritate the bladder and give you this flare of symptoms like you have a full-blown urinary tract infection, but it's not. It's just an inflammatory response. And that leads me to treatments. Limit bladder irritants, cut them out completely, and then slowly reintroduce things if you're feeling better. That's number one. Number two, pelvic floor physical therapy with biofeedback. You can actually see a specialist who can help you work on your pelvic floor and your bladder, and that often helps with the symptoms. There are a handful of medications that I do try for patients who are refractory to these first two options. Nothing is FDA approved for painful bladder syndrome or interstitial cystitis, but I do have a few things that are tried and true that work well for my patients, and so I will try them from time to time. Then we can also do cystoscopies, biopsies, cauterize any lesions that may be in the bladder that may be causing this pain, even stretching the bladder sometimes. And then we put some medications or cocktails in the bladder that can help to soothe the inflammation. So there's a sort of like end of the road treatments, and there's more, but this is just to give you an idea. So in all, I see a ton of patients with IC, interstitial cystitis, painful bladder syndrome. So if you're in my area, come see me.